So tell me a little bit about the veneer process.
Absolutely.
Like how do people know what it's going to look like at the end?
Definitely.
And who's a candidate?
Yeah, so I'll kind of walk you through the process first. Actually, let's talk about who's a candidate first. So a lot of patients, they're just unhappy with their smile. Maybe they're a little bit older, maybe they're 60s or 70s, where they're unhappy with the appearance of their teeth. Maybe their teeth are now starting to show cracks. Maybe they're chipping. Maybe they're turning brown, and they're just unhappy with the way maybe they're getting gaps between their teeth now where they didn't notice them before, and they're wanting to do something to improve their smile. And porcelain veneers can be a great option for, like I said, anywhere from 40 up, full range of patients actually, age range. But it basically gets them that smile that they've always wanted just within a few visits.
What does instant orthodontics mean?
So
using veneers.
So instant orthodontics is if teeth are slightly shifted or rotated and the patient, we've maybe talked to them about Invisalign and they're like maybe not wanting to do or pursue Invisalign and they're just wanting to get their teeth straighter just within a few visits within maybe 2 months or less, we can consider doing instant orthodontics.
Okay.
But the veneer process would be the first visit, patient comes in, we sit and we talk about their smile goals, how they want their teeth to look, maybe some of the smiles they like or dislike, and we talk about color, shape, and all these things, the artistry of how we're going to rebuild their smile. We work with our lab very closely and intimately. We use a great lab out of California, true artists who do cosmetic dentistry on
Because I
veneers.
feel like I could spot veneers walking down the street. You say they could look very natural.
They can look extremely natural, and I always tell patients, like, I don't want people asking you where you got your veneers. I want them to say, hey, did you get a haircut, or hey, did you get your teeth whitened? Like you look good. Something looks good about you. Like that I can't put my finger on. And I feel like that's the great cosmetic dentistry that we want to offer, of something that, and some of our patients do want to go super natural, where they want it to be seamless, which porcelain veneers can achieve. And some of our patients want to go kind of bright white, kind of Hollywood, and that's totally fine too. And we're pretty respective of however our patient wants to go. But first visit consultation, we talk about those goals. Do we want it natural? Do we want it more?
And you show them pictures.
Oh, we show them many before and afters, cases similar to theirs. And then we bring them in for a first visit, which is like a preparation visit, where we actually put temporary veneers on. And the temporaries are the great thing about the temporaries are it's basically like a trial run, a preview before they get the final permanent veneers. So if they still want to make adjustments, say if they say, hey, I kind of like this, the way we're going, maybe I want them a little bit longer or a little bit shorter, or hey, can you make them a little bit more, so
it's kind of like a try-in period.
A try-in period, which is great. So we're able to do that try-in period with the temporaries, and then the final result is placing the permanent porcelain veneers to, again, give them that smile that they've always wanted.